current COVID-19 pandemic is discussing the universal access to healthcare and human rights.
Access to diagnostic and other medical equipment and more. So how does the Department of Health plan to address this? Greater transparency and dissemination of understandable information on the NHI is required. For example, how does it work at a very basic level? What services will be provided? What options does a person have to access services that are not provided for under the NHI? And do private medical aids exist under the NHI? This is quite clear to people working in the public healthcare field, but it's not to the majority of South Africans. And access to information must be stressed as a particular concern. The Commission has in the past really battled tremendously to obtain information from the Department of Health in attempting to discharge our protection and monitoring mandates. In the last financial year, it was thanks to Dr. Anbin Pillay that the Commission was able to get positive responses to many of our requests for information and attendance at events. But that was the exception rather than the norm. And this lack of access to information and responses impacts greatly on our work, particularly our monitoring mandate. Hopefully, we can continue the relationship with Dr. Anbin Pillay and the incoming DG, Dr. Sandile Buthelezi. On the technical aspects of the NHI, I think much work has been done on developing indicators or criteria to assist with the decision-making on what the package of services will include under the NHI and how resources will be allocated. The Commission has worked with the Wits School of Public Health on priority cost-effective lessons for system strengthening in South Africa. The process did ensure that human rights-based principles were central to the NHI. For example, equity. And it's hoped that human rights principles will remain central to the decision-making process and that the services provided will respond effectively and proactively to the healthcare needs of the majority of people that it serves. I also hope that the NHI system would be adequately streamlined to avoid an onerous system that will inhibit access to healthcare for many. The Commission, as well as thousands of individuals and organizations, have commented on the NHI bill, and it's hoped that the trends in these submissions will be considered carefully. In addition to good health outcomes, good health outcomes cannot be achieved without comprehensively addressing all the social determinants of health. It is therefore, I think, imperative that state departments cease to work in silos and earnestly collaborate with other state departments, such as the Department of Basic Education, the Department of Education, the Department of Mineral Resources, because we are seeing dire health impacts in those sectors that are not being accounted for. So between state departments, all spheres of government and civil society and the private sector to achieve effective key performance areas and positive health outcomes in South Africa. I think that the Commission is of the view, and so am I, that ultimately the NHI will be of great benefit to the general population and for the advancement of human rights in South Africa. But it must continue to be implemented with meaningful public engagement, access to understandable information, and cognizance of the rights of all users, both in the public and private healthcare sectors, particularly marginalized groups of people. I think only then will it bring out the positive qualities of both the public and private sectors, and then meaningfully increase the right to access healthcare for all, and ultimately impact positively on poverty and inequality in South Africa. Thanks.
Thank you, Yuri. Some of the key issues that you had raised was the role of the International Committee for Economic and Social Rights that recently released recommendations pertaining to access to the range of socioeconomic rights, including healthcare in South Africa. You also spoke to the importance of access to information and the fact that we need transparent information in decision-making processes. So now I'd like to call on Safura Abdul Karim to speak to some of these tensions that we've experienced during the pandemic. There's been much concern raised about the limitation of our human rights to advance public health imperatives. Could you talk us through some of tensions.
Yeah.
I'll get the numbers will be recording. I could hear a little.
Done.
Yeah.
I think I was a bit more flowing now because no, I think I go into a zone when.
Good afternoon, everyone. My name is Safara Abdul Karim, and as Tandi said, I'm a public health lawyer, and I focus on human rights, constitutional rights, and also non-communicable diseases. I was asked to speak specifically about the human rights implications of the COVID epidemic and South Africa's response. But given that this is a discussion about universal health coverage, I'd like to just talk a little bit about how we choose to prioritize things within a healthcare system and how we need to see human rights in that context. So, when we're looking at an outbreak like COVID, it's very, very tempting. And I think there's been a lot of discourse about spending a lot of money on pandemic preparedness. There's a talk about really trying to prioritize treatment of COVID and pour resources into things like buying more ventilators and expanding ICU capacity. And, these are all very important things. Scaling up testing is critical, and, creating a vaccine is absolutely fundamental. But there needs to be a recognition, I think, at the same time, that the healthcare system is not the start and the end of our response. And these kinds of tools have a very limited role when you have a novel outbreak happening. At the moment, our most powerful tool against the outbreak is something as simple as water. Clean water and soap can play a huge role in limiting the spread of the outbreak. Yet, we are in a situation where the most vulnerable in our society do not have access to clean water, do not have access to adequate sanitation, and are living in situations where they're overcrowded and cannot practice social distancing. So when we look at Section 27, in the context of this discussion, we've been talking a lot about access to healthcare. But Section 27 also contains obligations on government to provide access to clean water and sanitation, electricity. There are various other provisions in the Bill of Rights that protect access to housing, for example. And the reality is the COVID epidemic has exposed the importance of those fault lines and failures to fulfill those obligations. So when we think about making any kind of healthcare system sustainable and also ready for an outbreak, we really need to look at how we can holistically realize all the different components of society that make sure that people can be healthy. It is useless to expand ICU capacity 100-fold if you can't get people to have clean water and allow them to practice sanitation. So that's the first thing about this pandemic that I think has been slightly overlooked and I think is really important to understand. And scaling up sort of the realization of these rights means that overall people's health will improve and there'll be less of a burden on the healthcare system. And what that will mean is that universal health coverage can be something that is sustainable. The NHI system can become sustainable if not as many people are relying on the healthcare system. So that's the one point I wanted to make. The other point I wanted to just make about the human rights issues with specific regard to the COVID response is there's been a lot of discussion about how the response is draconian, it's infringing on liberties and rights. And that discourse is complicated in the South African context because we don't just have civil and political rights protected in our constitution. Your right to, for example, purchase alcohol and make all kinds of different decisions isn't the only protection that we recognize in the constitution. We recognize people's right to life. We recognize everybody's collective right to access healthcare. And so when people are talking about, for example, needing to protect their freedom of movement, we have to recognize that people moving around freely in this context is going to adversely affect other people's right to health care, for example, or other people's right to life if they're immunocompromised. So when we're talking about the human rights implications of our COVID response, it's not as easy as saying our liberties have been infringed. We have to recognize that there's a balancing act happening where on one side, yes, certain civil liberties are being infringed, but on the other side, certain fundamental socioeconomic and human rights are being protected through these other deprivations of liberty. So those are really the 2 points I wanted to make. I think fundamentally, when we're talking about a pandemic response or when we're talking about universal health coverage, our response needs to be entrenched into human rights. It needs to be entrenched into improving society overall, and it needs to be guided towards the objective of realizing human rights and also improving health. So that I'm happy to take any questions, but that's all I'd like to say for now.
Thank you, Safura. You mentioned important points about the interdependency and indivisibility of human rights as per our constitution. We know that in terms of our constitution, the justiciability of socioeconomic rights is a necessity in order for us to fully enjoy our civil and political rights. And so the other point that you raised about the importance of realizing rights, but also advancing healthcare, and the importance of quality access to other services such as water, sanitation, that we can't have these, we can't negate those rights if we are going to advance the right to healthcare, is something that I'd like to, for Shanaz to speak to. Dr. Kerrigan had also mentioned the importance of preventive mechanisms and the role of community health workers in protecting healthcare in our society in a collective manner, given the shortages in our healthcare facilities. Shanaz, given your experience working with public health workers in impoverished communities, what are some of the key concerns that have been raised by some of our frontline workers during the pandemic? Thank you.
Good morning, everybody, and thank you for this opportunity. Thandi, that's a really important question to think about. What are the concerns that healthcare workers have raised? And within the civil society group, there's been a lot of concern from community health workers out there in the community around personal protective equipment, around them putting themselves at risk for really minimal pay. And they're also quite concerned about the stigma that is they face when going to visit homes. So, when it comes to personal protective equipment, I think that community health workers have been asking for PPE for a really long time. And just in about February this year, community health workers told us the story about one of their colleagues who had contracted TB, and she reported, and in her opinion, she contracted TB from one of the patients that she visited. And having gone to the health facility, gone to find out if there's any kind of UIF, any kind of support, any kind of occupational or labor support for her, she was turned away saying, well, we don't know where you've gotten your TB, and you've got to, access healthcare like any other patient who comes to the communities. So in terms of PPE, it's a historical struggle where they really are concerned about, will they get, in this COVID time, will they get enough gloves? Will they get enough masks? Will they get enough hand sanitizer? Will the communities be informed about their role? And a few of them actually have reported being rejected by communities with both the concern that community health workers will be carriers of COVID and coming to their homes, or that if they do come to their homes, there's this concern that they'll have the stigma that, oh no, there's someone with COVID-19 living in this house. But I think, overall, community health workers and health workers, especially in a primary care setting, are the backbone of our health system. And we really do need to ensure that they have the right kind of support, protection that they need. And given that these community health workers are largely Black women from vulnerable communities in which that they serve, they also have a whole host of their own challenges that they face and often have to take out of their own pockets to kind of support the communities that they serve. And this is unfair, and it's going to be quite a burden for them, especially in COVID context, where the requirement will not simply be screening and tracing of COVID, but a range of social issues that include food insecurity and other things that the communities will need. Tandy, should I go on to explain some of the other concerns that civil society have been raising, or should I wait until later?
Raise some of those issues now because you've just given us an overview of the concerns about community health workers. But as Safura had mentioned, the interdependency of all human rights need to be realized collectively in order for us to really tackle the pandemic head on. So if you can speak to some of those concerns and how they relate to healthcare, we'd appreciate it. Thank you.
Yeah, so I mean, I think I'd like to also start, with the definition of health for me, because health as a fundamental human right, as defined by Alma Ata Declaration, is not just the absence of a disease, but having a healthy lifestyle. So in essence, what we want is to have a patient that might have a disease, but be able to live healthily with the kind of network that they have, and the idea is thinking about a comprehensive primary healthcare approach, which is a progressive approach to health. And I think, in terms of the South African Department of Health has recognized this, but we often don't see it from the in the ground. And COVID-19 has really brought us an opportunity to recenter the health system away from this kind of top-down curative approach to a much more comprehensive approach, which is community-oriented, community-rooted, community-led, community-organized. And I think in this way, this is where these issues around stigma, the high rates of gender violence, the fears that healthcare workers are bringing disease can be addressed, because communities being critical part of the decision making can really come to the fore, And then I think when it comes to another critical concern that community civil society is having is how do you think about the South African context, which in some ways we've taken as normalized, but that actually going forward cannot be a normal that we accept. And if you look at universal healthcare, it's actually in the Sustainable Development Goals as target goal number 3, and it looks at universal healthcare as a human right with the slogan, leaving no one behind, and it is about bringing good quality universal care to all without a financial burden. And essentially it's saying that those who need healthcare the most should get it the most, and when we look at South Africa, universal access is stymied. And it's been mentioned a few times today that it's around the inequality in the social determinants of health, So, and given this context of these and high rising unemployment, food insecurity, poor hygiene, things like that, when that patient then encounters the health system, which is inequitable from rural, urban, inequitable across class, across all sorts of reasons. The healthcare system is sometimes biased towards them. And someone mentioned Life Many, and that's a perfect example that those who needed access the most were given the least access and probably at the poorest quality. So I think in this COVID time, it's quite urgent, and it's where we know that there's going to be a massive need for resources. And the state has shown us a commitment to working with the private sector. What's not clear is how that will materialize in such a way that if I come from like Site C in Kailicha, or if I come from Constantia, what will be the criteria by which I will get access to a ventilator, a bed, and so forth? So I think one of the concerns that civil society has is we need to use this as an opportunity to develop universal standards or protocols across both private and public sector that is based on values of justice and of human rights, so that the two systems can work together, and that healthcare workers on the front line, when they're making decisions about who gets to use the resources and how the priority setting has been envisioned, it's based on these fundamental values of justice, human rights. So that, for example, if somebody who lives in Kailicha, but she actually has an opportunity, the chances of surviving, and but she can't afford to pay, she actually gets the care that she needs. And then another thing to say is that we've learned from HIV, and we've learned from other diseases that you can't take a vertical approach to a pandemic, and we really need to think about what's going to happen with the avalanche of unmet need that's going to occur. So we need to be thinking now how we pool resources so that COVID is not, we don't deal with only COVID, but that we take a very comprehensive approach with community health workers, with a strong, comprehensive primary healthcare approach, and that as these as even issues in the future where we have perhaps even climate change unfolding around us and there's more disasters.
All right, the South African Human Rights Commission, they're hosting a webinar on the current COVID-19 pandemic and basically discussing the universal access to healthcare and human rights, and initially talking about the national health insurance as well as the public health and what basically those two mean. And NIHI is basically the funding mechanism to ensure universal health coverage, and public health, well, it has to do with the science of protecting the safety and improving the health of communities through education, policy making, as well as research, and how it relates to what we're currently dealing with, which is COVID-19. We'll have to leave it there for now.